You're in the gray. So, it is September 24th, 2014. I'm a full-time grad student now, and I only work part-time, and recently my neurologist, who I originally liked, told me she's convinced that a lot of my symptoms are due to psychological stuff, which my therapist is like, no, that's not right. In the last correspondence I had, I was letting her know about some symptoms I've been noticing that have kind of gotten a little bit more magnified than the last time we talked. And I let her know, and she was like, you should really talk to your therapist about looking about mood disorders, and if you have one, and get on an effective treatment plan, and see if that rules out some of your symptoms. Take in mind, it generally takes about 1 to 2 months. Right there, for one thing, I'm going to grad school to be a licensed mental health counselor, so when she's giving me the mind frame of between 1 to 2 months, generally that means that you want to put me on drugs and see how they work. I'm very against drugs now. Personally, I think for some people it really works effectively. But if you're going through this medical stuff, when you're going to have the mindset of being, doctors know what's best for me. Wrong. Doctors do not know what's best for you. You know who knows best for you? Yourself. So in the beginning, I had this mindset of being, doctors know what's best for me. If they're prescribing me medication, I should be taking it. And let them know, have feedback on how the medication's treating me, but they have the best interest in my mind. That is completely false, because when I first started this, which was more than a year ago, I have a bag. Well, I have a whole drawer full of my medical stuff. And I have a sister who's a recovering alcoholic and addict. And when she first time came over and I told her about my drugs that I had, she was shocked of how much they were dosing me. And her boyfriend, who is an EMT on the side, told me that they were also shocked that they were not keeping in check with my blood pressure, which you should always make sure that they're doing that when they're putting you on medication, because a lot of these medications can really fuck up your liver and a lot of other stuff. So, where is this baby? Yes. Okay. So they first started me off with neurologist number 2. They thought I had just severe migraines, so they gave me a sample of Trextamate. Let's see if I can get Trextamate. I personally did not like this. Then they also gave me a trial of Zogmig, which I don't think I got to test this yet. So then they gave me, let's see, I don't know if I have it out. Well, I can show you in the box. So on this box it has the ingredients that I currently take that for some of my symptoms. It does help me with some of my symptoms. Some of them helps with me with the headaches and intense like stuff that I have right there. So I currently take Sumutran for my migraines. And I was on a high doses for that, and I didn't really like it. So then, I also sometimes get pain in my shoulder, and it generally gets, not just the trembling that I get, but also it's tingling and it's painful. So then they prescribed me naproxen. From my knowledge, naproxen, that is like one of the main ingredients for relief. I like this stuff, but the stuff is like heavy duty. This is 50 milligrams, This from my sister says I can get a lot of money off the street for that. So then, they thought I had something virally wrong with me. So then they gave me, Cipralefagon, also 500 milligrams. This didn't do anything for me. So then they switched me to this thing, Bilasorcor, which did help with some of the tingling that I had. But then gave me a whole boatload of other problems. And then, So then they gave me tropopamate. This is the neurologist who thought I had seizures, which is a weird, different kind of seizures, even though I was convinced I had MS and I still am undiagnosed. But he gave me this shit. And at 25 milligrams, I was okay. It wasn't really working. He gave me, and I was supposed to have about 5 refills, but as you can tell, I had a lot of pills. So when I told them I really wasn't feeling anything, so they umpage on that one. And they gave me the same for 100 milligrams. And it went from, for this baby I was supposed to take 4 in a day, and then for the 100 milligrams I was supposed to take 2 a day. So this is a lot of fucking drugs. I don't even know what this shit does. I know how it made me feel though. For one thing, I have PTSD, and my PTSD has been very manageable since the last 6 years now, and my anxiety. This stuff, however, made me feel really not good. I actually personally decided to get myself off of it. I lowered my dose. I had the prior knowledge of not immediately stopping the medication, because that could also do a lot of bad stuff for you. So instead of taking 2 for 1 week, I was dropping it down to once, and then after that week, I just took it every other day, and then after that, and then I was like every 2 days, and then after that, I was done. But this stuff made me trip, legit. I would see things that weren't really there. Driving really was not fun, because there's constantly, I thought someone was jumping out into the streets. So I was seeing things with this stuff. My tingliness got worse with this. I got not only tingliness generally isolated to this arm, I got it all over. I couldn't feel my feet. I was very confused. I got very drowsy. I was not thinking right. I got very slowed. Got very confused easily. I definitely got more depressed on this stuff. It was like discontent with everything. I really didn't want to do anything. I just wasn't there. Hated this shit. Told my neurologist about that, neurologist number 3 or 4, who thought I had seizures, even though all this tests that I had were coming back negative for seizures. Still was putting me on fucking medication for seizures. So then he put me on Gabatran, which is also an anti-anxiety medication, but it's also used for seizures. And I was supposed to take this 1 capsule by mouth at bedtime for 1 week, then 1 tablet twice daily for 1 week, and then 1 capsule 3 times a day. It's 100 milligrams. After this, and all of my tropopamate coming back, and all of my tests coming back saying that I was negative with seizures, I don't understand why this doctor chose to not only uppage, but give me more drugs when I told him I was really against drugs. So I took this for my own choosing to take, but as you can tell, I don't even think I opened this once, honestly. I still have this in my possession. I haven't. Then I switched neurologists because I went to an MS neurologist, and she, at the time, was saying you could have MS, you could not get off those medications because you shouldn't be on them. So right there, I started out with a doctor who's prescribing medication that could be fixing these problems, but a lot of times these problems were actually getting worse because of the medication they're giving me, and that's also because of, I think, the misdiagnosis that they were treating me for. Then I went to third neurologist of thinking I had seizures, and was giving me seizure medication, which can bring a boatload of other information. And so you know, if you're ever going through this, if you're on seizure medication and your PCP or other doctors or cops find out, a lot of times seizure medication makes you not be able to drive. So that's a problem. So then when I went to the MS neurologist, I got all of I can't even show you. Well, maybe I can. I can't show you the other ones. Got off all of this medication. She asked me if there was any medication that was kind of helping, which was the Sumutran. So she gave me a straight dosage of Sumutran at 25 milligram, and that's what I think now I'm at 100. And that's what I'm on, and I take that as needed. It's not once a day or anything like that. And my MRIs prove that I do have something wrong with my brain. They just don't know just yet what it is. I'm currently on no routine medication. That's on my personal choice. But recently with my other new neurologist that I have who's pushing that I should be on anti-anxiety medication or mood stabilizer because I have a mood disorder, which you're not a psychologist. You don't have the authority to suggest me to have that. If anything, you should be suggesting me to see a psychiatrist who could be prescribing me for these appropriate meds. That, for one thing, I should be working with a psychiatrist for X, Y, and Z for him to effectively evaluate and figure out what kind of disorders I have. The fact that I've been in therapy for the last half year of my life. I'm 26, so and the fact that I've been with my current health therapist for the last year and a half to deal with these problems, and she thinks that her clinical knowledge and wisdom that I do not fit a mood disorder, and the fact that my PTSD and anxiety is under control and actually has been a lot more alleviated the last couple of years doesn't really make any sense. So that's why I'm really pissed off with this current neurologist, and I don't know if I should change. I'm so sick of change. She's my 6th or 7th doctor I've been through now for the last year and 2 months. So I'm kind of sick about moving around. But this is going to be a long episode, but to be honest, in the beginning, you're going to trust these people. Do not trust them. They do not have the best interest in you, and a lot of times they don't understand what really is going on. And especially communication between a medical person and a layman's term person. So if they are prescribing you medication, I would say if you feel okay, you can try it. But anytime that you're not feeling good, definitely step up for yourself and advocate for yourself of being like, I don't want to take additional medication that's for seizures. I don't want to take additional medication that's making me see stuff. I don't want to take additional medication that helps me with the pain, but the pain is not the big issue. The fact that I'm going blind is an issue. The fact that I can't sometimes feel my feet and my hand, specifically on the right-hand side, is a problem. The fact that I get confused and have short-term memory, and I'm very heat-sensitive, is a problem. This drug cannot help me with that. Or any of the other drugs that they prescribe me. So, and definitely in this age that I feel like it's a quick fix, and it's very easy for a physician, in any field or specialty, it's very easy to fix that problem, and get that patient out the door, and what have you, to prescribe the medication. And a lot of times if you're undiagnosed, and you've been undiagnosed for a couple X, Y, and Z years or months, they're going to be more pressing about that because you fall in the gray, and it's a very hard, a lot of times it's kind of like wait and see about your symptoms, and I personally feel like my symptoms do not need medication, and I'm very heavily against medication because from my experience, medication makes things worse, and the fact that I'm fine if I find out that I have like Lugard's disease or a certain type of cancer and I have to do chemo and be on different types of medication, I'm fine with that. The other kind of medication, I don't really count it because it's like a vitamin. The last blood test, they showed that I was low on vitamin D, and the fact that I did have an MS neurologist and I could have MS, they did prescribe me to take more vitamin D, and I've been pseudo doing that. Again, it's on my own choice. And they also suggest me to take some vitamins. I bought it. I haven't opened it yet because I'm not gonna lie, I know for a fact that it's because, and I have more, I just grabbed the most recent ones. As always been healthy, exercise, never had any psychological issues that ended me to rely on medication heavily or anything like that. Everything has been managed. The start of everything, I've been on 9 different kinds of medication. It's never helped me. And a lot of times, a lot of the doctors never asked me if I ever wanted to be on this medication. They just prescribed it. They never asked me if I was for medication. They never asked me about alternative plans for medication. They never checked in with me about how the medication was feeling. It was more up to me. And also, they never scheduled blood tests to see what this medication was doing for me in the long run. How it was affecting my liver, how long it was affecting my blood clots, how long it was affecting my heart, how it was affecting everything else. So these are big issues that you need to discuss with your healthcare provider and make them understand what is important to you and how you want to be. Also, if you are on medication, these are effective questions that you should be asking and advocating for yourself to your healthcare professional and practitioner, that you should be having routine blood tests every 6 months or so to see what this medication is doing to your liver and to your stomach lining, on how if it's being injected or ingested, and also definitely be aware and definitely push that this is not okay with you. This personally is not okay with me. And going forward, I make it very known that not only the office, I ask, does the doctor really prescribe a lot of medication? Are they associated with any prescriptions or pharmacies? But I definitely like to know the neurologist or the PCP. I'm very against medication. I do not want to be on medication. And everything that I've been working on in the past with my anxiety and my PTSD has been very manageable with the therapy and the setting I've been in. And it hasn't gotten worse. Like I said, if anything, it's gotten a lot better. So put your foot down about these things. And doctors do not have the best opinion a lot of times, especially when you're in this category. They just be wary. Be wary. So, probably talk more about that. And I'll definitely let you guys know what goes on with my neurologist and what I do. But I'm sorry this is really long. But I hope that's helpful.